Welcome back. Thank you very much, Prof. And last time we discussed a couple of issues and we discussed a couple of questions about the period of recovery and the daily activities. We received a few questions and a few comments. Actually, it was well received. Shall we carry on today with further?
Yeah, I'm very happy
questions?
to carry on.
So our next question is regarding the diet. Anything in particular, Prof? A lot of patients ask us, should I eat this? Should I refrain from eating that? What could you tell us about this?
Yes, I mean, I think the emphasis is always that you should have a balanced diet. I think we don't encourage people having what we call fatty diets, and but the key thing is that you shouldn't really be getting more than 30% of your calories from fat. And I think you've got to look at your diet with a dietitian if necessary and see if you can reduce the fat content. And particularly if you have a diet which is very rich in saturated fats and a diet which is rich in salt, that's something you need to try and reduce. So if you are eating a lot of red meat, I think it's good to try and switch to white meat and to fish, which obviously has the right sort of fats, if you like. There are good and bad fats, and the fish has the good fats, which are what we call HDL cholesterol, rather than the not so good fat, which is the LDL cholesterol. You may have heard a lot about that in the media. So I think diet is very important, but it can be very enjoyable, and it doesn't have to be like an onerous part of your management for the long term.
And regarding the weight, Prof, some patients pick up the habit of weighing themselves every day after the surgery, simply because that's what we used to do in the hospital. We weigh patients every day. So once they go home, they carry on the same routine. What do you think about that?
Well, I think like anything, one mustn't get too focused on being too, if you like, focused on the weight. If you want to weigh yourself, that's absolutely fine. We don't think it's absolutely necessary. I think weighing yourself once a week is probably well enough, but a lot of patients obviously are in a habit of weighing themselves anyway on a daily basis. But if you are going to do that, then just try and do that in a way which is, if you like, methodical, in the sense that you're going to weigh yourself the same time every morning, ideally after you wake up, before you have breakfast. Use the same weighing machine and take more than one reading. So take an average of 3 readings to make sure you're weighing yourself properly, and obviously have the same sort of amount of clothing on, and don't weigh yourself with shoes.
My next question is a rather grey area, Prof. We all come across every day. Almost all patients don't feel particularly normal after heart surgery. It's just the way it is. Some patients cannot draw the line between what is actually requiring medical attention and advice and what is the normal post-operative feeling of a cardiac patient. I always tell patients, you will start feeling normal after 6 weeks, but within these 6 weeks, some patients cannot tell what's normal, what's not. Can you tell us more about that, please?
Yeah, Hadi, I think that's a good point you've picked up on, because I think a lot of patients do feel very different, and what I want to do is to really try and reduce their anxiety about how they feel, because you're not going to feel normal. That's the bottom line. You are going to feel different. You've gone through a major procedure, a major operation, which is traumatic, and it's traumatic not just physically, but it can be traumatic mentally as well. And so there's going to be a lot of differences in the way you feel, both physically and mentally, and I think it's important to reassure patients that that is part of the course, and that's what they are going to experience. They are going to have good days, they're going to have bad days, and this is going to go on for many weeks. This is why we say that the full recovery may take up to 12 weeks, and there will be times when, for example, your appetite may not be good, and this can be related again just because of the operation that you've gone through, the anesthesia you've had, some of the drugs you have to now take for pain. This can all be reasons why your appetite is poor. Often patients say, well, my cup of tea in the morning doesn't taste the same, or the coffee doesn't taste the same. And again, this is a normal experience for most patients, but again, it gradually resolves, it gradually gets better. And it's not something that one should be worried about. It's something to be expected. And the other common thing, of course, is that the food may smell different, or doesn't smell. You can't smell it just as well as you could. You've lost the nuances of your palate, but it will all get better, and that can be a source of concern. But I think you have to remember that taste and even smell can be very differently, and the nuances you had of smelling and tasting can disappear for a period, and then it will gradually recover back to where it was before. And many patients also feel nauseated, and I think again that gradually subsides, and often is related to the drug therapy that patients are taking. And the other concern is quite a common concern, is the swelling, particularly around leg incisions, which patients may have if they've had bypass graft surgery. And generally, patients are a bit swollen and are a bit actually heavier than they were when they came into hospital. And this is a consequence of the operation and the fact that they've had to go on to heart-lung bypass. And so the reason they're heavier is because they're retaining water, and this water retention gradually subsides over the weeks they are recovering at home.
Yes.
But if they do have swollen legs, the solution is a very simple one. That is, wear the support stockings you were given. Otherwise, try and elevate the legs as best you can. If you're sitting in a chair, put your feet on a stool. If you're on a sofa, try and again keep the legs elevated. And often patients will find that when they wake up in the morning, their legs have gone down in terms of the swelling, and then they gradually become swollen over the course of the day. The other, I think, issue is one of altered sleeping patterns.
Yes.
And often patients find that for no reason they become, insomniacs,
yes.
and they can't sleep, and they're waking up at 2 or 3 o'clock in the morning for no good reason. And I think this is just because they've lost their normal sleeping rhythm. And again, this has been disturbed by the experiences in hospital and the various drugs that have been administered. And I think they need to get back into that, and it's best to avoid sleeping tablets if they can. If it's a real problem, it's something that their general practitioner or community physician can prescribe, but we would encourage them not to do that. We would encourage them to try and sleep naturally, because that's the best quality
sleep. It will eventually come around.
Yes, eventually come around, and if you've been exercising during the day, you will naturally sleep better at night.
Yes.
So I think that's the best thing to do, is to give it time, and it should come back to where they were.
Yeah. All right, that was very helpful, Prof. Thank you very much for explaining that to us. Hopefully we can meet again.
Okay, thank you.